Denise Thompson is an independent scholar who has been reading, researching, writing, thinking about, and sometimes publishing feminist theory for decades. She is an academic writer who has a PhD in sociology from the University of New South Wales for a thesis called Against the Dismantling of Feminism, a Study in the Politics of Meaning. It was later published by Sage under the title of Radical Feminism Today. Apart from her PhD, all her work has been done outside academe, while any paid academic work she has had has been sporadic, largely casual, and unconnected to her feminist work.
And hello again. At the moment, I've been writing a rather lengthy critique of transgenderism, which I've been putting up on my website as I finish each chapter. But the chapter I'm writing at the moment is called Where's the Evidence? It's a discussion of the evidence transgender uses to justify itself, or more precisely, the lack of evidence. Now, it might be assumed that with the release of the final report of Dr. Cass's investigation, there's no need for further commentary on the evidence, or lack of it, for the benefits or otherwise of transgender medical procedures. After all, Cass found that, and I quote, "This is an area of remarkably weak evidence," unquote. Dr. Hilary Cass is an honorary physician in paediatric disability. She's retired, but she's still a consultant. And she's a past president of the Royal College of Paediatrics and Child Health. And she was asked by the National Health Service England to chair the review. In part, it's a summary of the findings of 6 commissioned systematic reviews of studies of research on children and adolescents referred to gender services, plus 2 reviews of international guidelines and an outline survey of gender services for children and adolescents. All of this research was carried out by researchers at the University of York, which, like most, if not all, universities in the United Kingdom, has been thoroughly captured, but at least the researchers did their job, at least up to a point. All of them actually were women. I think there was one man, but most of them were women. All of these are published separately from the Cass report, although they're referenced there. Cass summoned up the results of the systematic reviews as follows. The University of York's systematic reviews demonstrated poor study design, inadequate follow-up periods, and a lack of objectivity in reporting of results. As a result, the evidence for the indicated uses of puberty blockers and masculinizing, feminizing hormones in adolescents are unproven, and benefits, harms are unknown. Hence, the claims by the World Professional Association for Transgender Health in its version 8 of its standards of care are, as I said, quote, based upon a more rigorous and methodological evidence-based approach than previous versions, has been found, not surprisingly, to be false. So the Cass report has received a rapturous response from many of transgender's critics. Julie Bindel called it a victory for women, children, and common sense. She believed that it had brought us one step closer to throwing the harmful delusion that is gender ideology into the dustbin of history. Bernard Lane, who's been a major critic in the Australian press of the transgender medical treatment of children since 2019, said that the Cass report holds up a snapshot of missing data, cluelessness, and fudging of evidence in gender medicine around the world. Graham Linehan said he was proud as punch, and J.K. Rowling said, the review's conclusions will have come as a seismic shock to those who've hounded and demonised whistleblowers and smeared opponents as bigots and transphobes. The trans lobby, of course, was not pleased with the Cass report. Their first complaint arrived even before it had been released. It emanated from a trans activist calling himself Alejandro Caraballo. Sorry about my Spanish accent, Marietta. Who started with the internet slang TLDR, which stands for too long, didn't read. A statement that was more than borne out by what else he went on to say. He tweeted what appeared to be a direct quote of something said in the Cass review. And I'm quoting what he said. The Cass review said, "We disregarded nearly all the studies because they weren't double-blinded controlled studies. We also stopped reviewing newer studies released in the last 2 years. As a result, we were left with very little evidence," unquote. This is a blatant lie, and it's easily checked. No such statement appears anywhere in Cass's final report, and neither does it appear in either of the 2020 reviews by the National Institute for Health and Care Excellence, that he went on to quote in a screenshot, alleging that they came from the Cass report when they didn't. The trans lobby's reactions varied from the outrageous, their usual anonymous death threats to Cass herself, which the police took seriously enough to advise her not to take public transport, to the usual denial and lies. The criticisms most often repeated by the trans lobby were that the review had included only 2 out of 103 studies of puberty blockers and cross-sex hormones, and that it discussed only random controlled trials. The reference to 2 out of 103 studies is probably a misreading of what the report actually said about those studies. The review found 50 studies of puberty blockers, only 1 of which was of high quality, while 25 were of moderate quality and 24 were of low quality. The 24 low-quality studies were excluded from the reported results because their conclusions were unreliable. The other 26 were included. The 26 moderate quality ones were included. Then there were 53 studies of cross-sex hormones, and again, only 1 was of high quality. But all were included in the reported results. There were only 2 high-quality studies, but they were not the only studies included in the report. Indeed, it was because the studies were of only low or moderate quality that the review found the evidence was remarkably weak. Moreover, Cass did not reject research that was not a random controlled trial. None of the studies discussed in the report were random controlled trials. All she said about random controlled trials was that they were the gold standard of research and that there are hardly any random controlled trials in studies investigating children and young people receiving endocrine treatment for gender incongruence dysphoria, unquote. Stonewall responded as though the Cass review was merely reiterating views that Stonewall itself had held all along, while any criticism was directed towards NHS England, but not to the review. They managed to pick up areas where Cass agreed with them, justified at least in part by Cass's own acceptance of the transgender agenda, and I'll come to that in a minute. For example, Stonewall said that the review argues that the evidence on puberty blockers is insufficient, but also acknowledges their efficacy for some trans young people, and the review did not call for blanket bans on puberty blockers. Both of these statements are accurate. Former Stonewall CEO Ruth Hunt was less accurate. She was reported in the Times to have protested Stonewall's innocence. They had simply trusted the experts, she said. Mermaids also claimed innocence. Their CEO, Lauren Stoner, had her own version of the leaving it to the experts denial. She was reported to have told Sky News, "We were commissioned to provide some focus groups to the CAS review, but otherwise we're not clinical professionals. We don't get involved in the decisions that are made between a young person, their family, and their clinicians," unquote. J.K. Rowling's reaction to this was typically forthright. Stoner's response was, she said, "total, shameless lies." Mermaid's fingerprints, she said, are all over the catastrophe of child transition. WPATH lied too, but I don't have time to go into that here. Cass didn't respond in detail to her detractors. She did presumably avoid public transport, and she said she stayed away from X. She did object to what she called the disinformation being spread by trans activists and influential figures such as the Labor MP Dawn Butler, that she had discarded most of the research. But while the trans lobby's criticisms are either false or deranged, for example, the hashtag #CassKillsKids from broadcaster and trans activist India Willoughby, there are reasonable objections that can be raised to the CAS review. One example is the review's both sides assertions, implying that both transgender and its critics are equally responsible for the toxicity and polarisation of the controversy surrounding the use of medical treatments. To give just one example of Cass's both sides argument, she said, "Despite the best intentions of everyone with a stake in this complex issue," I love that word complex too, it's a juju word meaning I can't decide between two things, and I'm not going to tell you anyway. So despite the best intentions of everyone with a stake in this complex issue, the toxicity of the debate is exceptional. I have faced criticism by transgenders critics, but she doesn't say so, for engaging with groups and individuals who have a social justice approach and advocate for gender affirmation, and have equally been criticised by the trans lobby, but she doesn't say so, for involving groups and individuals who urge more caution. There are few other areas of healthcare where professionals are so afraid to openly discuss their views, where people are vilified on social media, and where name-calling echoes the worst bullying behaviour. This must stop, she said. But it's not going to stop if the culprits are not accurately identified. It's not the critics of gender affirmation who are responsible for the increasingly hostile and polarised debate. It's not people on all sides of the debate who exaggerate or misrepresent the results of studies. It's the transgender activists, and she doesn't admit this. So neither Cass nor the University of York consulted any of the critics. They said that they prioritised two categories of stakeholders: people with relevant experience and organisations working with LGBTQ+ children and young people generally, and clinicians and other relevant professionals with responsibility for providing care and support to children and young people within specialist gender services. So they only spoke to the medical professionals who are working in the area and the trans lobby, actually, organisations working with alphabet soup children. Neither outspoken trans-critical women like Julie Bindel and Heather Brunskill-Evans and Julie Birchall and Stephanie Davis-Arai and Sheila Jeffries and Helen Joyce and Kathleen Stock, to name just a few, nor women's organisations defending women's sex-based rights, nor those who have created trans-critical websites and blogs were included as stakeholders. The review contained no mention of any of the over 70 resources that I list on the transgender homepage of my website, While most of these sources are not the formal academic peer-reviewed research included in the systematic reviews by the University of York, neither is the information provided by the focus groups of transgender young people or by the trans lobby, who are euphemistically named support and advocacy groups. There are also a number of other problems with the review. There's the language used, the acceptance of transgender terminology. Whenever the word woman appears in the report, it's usually coupled with transgender or trans, although on one occasion it has the cis prefix tacked on, an adult cis woman. Cisgender appears a number of times, used as though it meant something. Did Cass not know it referred to her? I would have thought she would have been insulted by being referred to with that term. I certainly am. There's the recommendation that using puberty blockers in research is acceptable. She criticises GIDS, Gender Identity Development Service or whatever it was, for dosing the young with puberty blockers, despite the fact that their own research showed no benefit and even some negative effects for girls, namely a worsening of internalising problems, depression, anxiety. There's also the euphemising. So the review says, from 2014, puberty blockers moved from a research-only protocol to being available through routine clinical practice. And then it says, the rationale for this is unclear. A short while later, the review says, the adoption of a medical treatment with uncertain risks, based on an unpublished trial that did not demonstrate clear benefit, is a departure from normal clinical practice. But it's not just a matter of lack of clarity or departure from normal practice, that GIDS should ignore evidence suggesting caution, no indication of improvement and some indication of worsening, and then try to hide these results is nothing short of scandalous. The appropriate response is outrage, not pallid euphemisms. There's also the assumption that the weakness of the evidence was inadvertent and could be remedied with better designed research and some good advice. In other words, it implies goodwill on the part of transgender researchers. But the review's researchers came across at least one instance of bad faith on the part of the transgender medical profession, apart from the weakness of the research studies. Attempts to improve the evidence base, the review said in its summary, have been thwarted by a lack of cooperation from the adult gender services. The University of York said in its overview of study development that 6 of the 7 adult clinics declined to support the data linkage study. A table lists the reasons clinics gave for refusing to participate in the study, together with the university researchers' response. For example, the clinics said that extracting the data would be too labour-intensive because some of the records were still paper-based. The university replied, support is in place to cover clinics' workload in relation to research studies, including extraction of clinical data. The university answered every one of the clinic's objections to no avail. But all these problems are the consequences of accepting the assumption that there are children and young people who need to change into the opposite sex, and that it's possible to achieve that. Cass makes that acceptance quite clear in the first sentence of her foreword. This review, she said, is not about defining what it means to be trans, nor is it about undermining the validity of trans identities, challenging the right of people to express themselves, or rolling back on people's rights to health care. Still, the review did acknowledge and emphasise the weakness of the evidence. And in that sense, it's a step towards the final defeat of the transgender agenda. The finding that the supposed evidence for the efficacy of transgender medical treatments is remarkably weak, even though that's a euphemism for non-existent, is a welcome addition to the growing list of transcritical resources, equivocal though it might be. It's not, however, the last word on evidence, both for all the reasons I've already mentioned, and because the review was confined to medical treatments for children and young people. The problem of remarkably weak evidence, not to mention deliberate obfuscation, is not confined to that context. The Cash report had nothing to say about censorship operating in the universities and academic journals, where research happens and is reported, nor was there any realisation that most of the information transgender appeals to is in the form of bold assertions unsubstantiated by any argument or evidence. And I go on to discuss that in the rest of the chapter, but not here. Okay, thank you.
Thank you, Denise. Thank you. I can see applause happening, so that's excellent. Thank you so much. And I'm sure there'll be lots of questions.